A very warm welcome to all the viewers who are joining us at Kopi events. As usual, the signature cup has come up, and you see, oh, sorry, it's over here. It's my buddy here. It's me. All right. So, cheers for everybody. Why am I saying cheers for coffee? All right, it's okay, right? As long as we're happy. Thank you once again for joining us. And today's topic is about iron deficiency. I'm very excited about it. Just about 2 days back, I went to the Iron Suites Medical Center to get my iron checked up. So we have some interesting results that's coming up already. So Dr. Dheeraj will be our guest speaker today, and we're going to speak a lot of elements on it in different spectrum, thinking about what we are. We might be looking healthy and fit, but in terms of the physical body, I think there's a lot of contents that we need to look at. But before we go on, I'm just going to cover a little bit on iron deficiency before I get the expert to talk about. It's about hemoglobin, it's about iron, especially women who tend to have fall into this category of iron deficiency anemia. Most of the time, when there's not enough red blood cells, you get very fatigued because they actually carry oxygen. And sometimes you feel tired and short of breath. But sometimes you also wonder why this is happening more all the time. But to get into it and understand every substance or the elements of what is blood is all about, and how do we get checked it up, and what it actually helps us when we say we fall under iron deficiency, or how we know that we will be in. Without any ado, I'm going to pull up Dr. Dheeraj from Iron Suites Medical Center. Dr. Dheeraj, I pulled you up, sir. How are you there, buddy?
How are you doing?
I'm good, sir. How are you?
Very good. Thank you for having me on the show.
Thank you so much for joining Kopi with Vance. It was a great pleasure meeting you 2 days back at Iron Suites Medical Center, getting my blood checked up. And of course, I know there's some interesting results that we're going to talk about later. Doctor, I've not done any introduction about yourself, but I will give you the pleasure to do an introduction of yourself.
Sure. So my name is Dheeraj. I'm a general practitioner, and I work at the Iron Suites Medical Center, which is a very niche clinic in investigating and diagnosing nutritional deficiencies, and also treating iron deficiency, particularly with an IV iron, which is what we specialize in the clinic.
Thank you, doctor. I mean, of course, I was looking at your bio. You did a very humble introduction, but when I was looking at the humble, that's also clearly shows me, I'm just going to pull up the records. You actually have done, you did psychology as well, doctor. You want to talk a little bit of that as well?
Oh, yeah. So in medical school, I did an extra year, and I got an extra degree in psychology, because I think it's very important to understand the psyche of your patient as well when you're treating them. It's not just the physical health that you're treating, and it's important to focus on the mental health aspect as well of the patient.
Thank you, doctor. Thank you so much. There was humble introduction about you as well. So our audience are there. Thank you so much. We have more audience tuning in, and I got lots of messages coming up as well. Today, it's going to be a little different. So if you do have any viewers that you do not want to, somebody want to be, a little privacy, you can actually send it to this WhatsApp number. It's from Kopi Events, and then I will read out the questions if you have any to doctor. Of course, we will not mention names. I think it's for privacy purposes. But if you are fine with it, you can always give us a comment here, and I will take it out to doctor, because we are going to cover a good presentation over 20 to 25 minutes on iron deficiency and what happens and what causes, so many stuff. But after which we also have an interaction session, which is going to be a lot of Q&A as well. So please share this video and participate in this chat group with us, all right? So doctor, I know you have the PowerPoints ready for our viewers, so can you pull that up, and then we can actually start sharing. And viewers, you should be having coffee as well, or water, yeah?
I've got my hot drink here.
Oh, you got, there you go. That's great, Doc. All right.
Okay.
Okay, I got more questions coming up. So yes, please keep on coming in. You can give the number if you want to. If not, you can just give me a comment section. I will definitely address all these questions to doctor, and then we will share about it. As I can see more viewers coming up, thank you so much. Please do share this video. Do share this session live so that more people can come and participate and understand about iron deficiency, which doctor is ready to do his presentation. I'm going to pull up the presentation folder. Doctor, here we go. All yours, doctor.
Great. So today we're going to talk about iron deficiency, which is actually the most common nutritional deficiency worldwide. So to start off with, what does iron actually do? So iron is actually the main um, ingredient almost that makes your hemoglobin. And hemoglobin in your blood actually carries oxygen around the body. So it's important that to know each ml of blood that you have actually contains 0.5 milligrams of iron. So half of your blood is actually made up of iron. Now, iron also has a lot more functions. Now, all these words look like jargon, very difficult to understand. But just to show to you that iron is involved in so many various processes in the body, from hair strength, nail strength, and also to DNA synthesis and DNA cell division. And this is important later on, which is why it helps us explain why the symptoms and signs of iron deficiency are so vague and far in between. So I think if you can take home one message from there, iron is the key ingredient for hemoglobin, which allows your body to transport oxygen to your cells, and it's important for the cells to be able to use it as well. So it's oxygen transport and oxygen utilization. Now, I won't take you through what we had done through school, which is about the iron metabolism, and I've simplified this diagram to essentially say that in your body, in a female, you've got about 3,000 milligrams of iron, and in a male, you've got about 4,000 milligrams of iron. Every day when you eat, you absorb 1 to 2 milligrams from your diet, but also you lose about 1 to 2 milligrams a day. That's either from your sweat, your urine, or in females, from your monthly menstruation. So now that we know how iron is sort of functions in our body, you can tell what the risk factors might be for someone to develop iron deficiency. So you either develop iron deficiency when you don't put enough in, for example, being a vegetarian, or having stomach acids or stomach inflammation and your body's not able to absorb it, or if you lose too much iron. So that through heavy menses, blood donation would be considered as blood loss as well, because you're essentially losing about 3 to 400 mils of blood each time. Having things like
Sorry, doctor, I'm just
hemorrhoids.
gonna pause you here for a while, and
Sure.
you can just come up to the main screen. So when we talked about iron deficiency, can we actually relate these to the women most of the time?
Yeah, as you can see, heavy menses, pregnancy, those are two of the very big factors that lead to iron deficiency. So because as men, we don't have our monthly cycles, that's pretty much the biggest risk factor that put women at risk.
How about the one who are doing a regular blood donors? Because I myself is a blood regular donor for the past 18, 19 years. That probably you might want to go through the reports later with all the audience of about my current status. But for those viewers out there who have been doing regular blood donors, I mean, of course, at the blood centers, after we donate, they always give us, iron tablets, so and so forth. But I do know there's some distortions or absorption ratio will be lesser. But is there other ways? We often hear like eating spinach or eating red meat and kind of stuff. But the vegetarians somehow or other falls under a little category because not much of varieties on that. But what is your take on these, doctor?
Yeah, so I mean, you're right. So to address the blood donation, that's, each time you donate blood, you donate about 400 mils of blood. That's almost equivalent to a female who's having heavy menses for 4 months. So each month a heavy menses would be classified as about 80 to 100 mils. So if you're donating blood 2-3 times a year, that's pretty much puts you the same risk of having, as a female, having heavy menstruation. So yes, regular blood donation is a risk factor. You're right, they often give you iron supplements after you donate and ask you to take it. But the absorption from iron supplements, as well as the diet, is so poor that it's sometimes very difficult for the body to replenish what you've lost through the blood donation or the menstruation. And spinach, yes, everyone says green leafy vegetables, spinach has lots of iron in it. But as you'll see later in one of my slides, that the absorption, especially from plant iron, the iron content in plants is so poor that you actually need quite a lot of spinach just to replenish the iron.
Doctor, just for an understanding purpose here, you mentioned 3,000 to 4,000 of mg of iron needed per day, right? So,
That's what
so
you have in.
okay. So how do we know that we are having the right amount of iron per day? I mean, is there a quantity that we need to eat? Because right now, when we say you need to eat spinach, but how much spinach is needed? Is there
Yes.
a way that we can monitor something like that?
So the recommended guidance is about 4 milligrams of iron a day, and I'll show you later a few examples. For example,
Okay.
um, spinach, 1 whole kilo of spinach gives you just 1 milligram of iron.
Wow,
Okay,
that's very little.
so it's very little. Exactly. A piece of steak, for example, gives you about 3 to 4 milligrams.
Okay.
But you can't
We're not going to
possibly eat.
reach. We're not going to
Okay.
reach 1,000. It's going
No.
to. It's yeah.
So
It looks like it.
yeah, so you have 3 to 4,000 in your body, and you absorb 1 to 2 a day from your diet.
Okay. Okay, that sounds crazy. Let's move on to the PowerPoint, doc, and we can understand more better.
Great. I'll move back to that. So basically, these are some of the risk factors that might put someone at risk of iron deficiency. And the basis is either you're not putting enough in or you're losing too much. So, like you just said, women, especially menstruating women of reproductive age 13 to 50, puts them at a big risk. Also, pregnant women, especially in the third trimester, also causes you to have a dilutional effect on your iron and makes you more likely to be iron deficiency. And also the elderly, so especially patients above 55 with chronic disease. The disease causes an underlying inflammation in the body, and this upregulates a protein called hepcidin, which actually blocks the iron absorption from the gut. So you might be eating all the right things, you might be taking all the supplements, but still your body's not able to absorb it because of underlying inflammation. So this is actually some studies to prove the at-risk patients. They did a study on women of childbearing age, meaning from about 16 to 50. They found 1 in 3 women were iron deficient. They looked at a study in Singapore in women above 55, and they found more than half of them were iron deficient. And this is a very interesting study done in NUH in about a year and a half ago. They took 1,000 women. They measured their iron levels in the third trimester, which is at 26 to 28 weeks, and they found that 3/4 of women were iron deficient. And when it comes to men, this was a study done in the Israeli army, and they looked at men before they enlisted and 15 months later after strenuous exercise, and they found that the number increased from 4% to 65%. And again, this study was a similar one, which was it's almost equivalent in male. You get about 20% risk of having iron deficiency when you're above 55 years old. So I just want to concentrate on two of the biggest risk factors now, which is
Sorry,
heavy
doctor.
menstrual.
We are just losing your voice a little. Is it possible if you can just increase up your volume a little bit there so that it's getting muffled a little? Thank you so much.
Okay. Is this any better
Thank you.
now?
Yeah, that's so much better. Thank you.
Great. So I just want to concentrate on two of the biggest risk factors that we see, and that's heavy menstrual bleeding and pregnancy. So heavy menstrual bleeding or heavy menses, most women don't go around talking about their periods. So how do you tell that you actually have heavy menstrual bleeding? This is a very quick questionnaire, and if you tick any two of these 4 questions, then you are at risk of heavy menses. So if you pass large clots, if you have to use double sanitary protection like a pad and a tampon because it's so heavy, or if you have to change your pads or tampons every 2 hours or less on a heavy day, or you have constant staining of your sheets or your clothes, then you might have heavy menses. And what I say, if someone has heavy menses, loses about 80 to 100 mils of blood. And the Yakult bottle there is to help you visualize in your head. If you think a Yakult bottle in a month, that's 100 mils. And as like I said at the start, each ml of blood that you lose is 0.5 milligrams of iron. So losing 1.2 liters a year is 600 milligrams of iron. So this is why heavy menses is probably the biggest risk factor for causing iron deficiency.
So can we say, doctor, technically that women falls under iron deficiency because during the pregnancies, right, the 3 trimesters, and also post-pregnant pregnancies, and also after their monthly cycles they go through. So can we say technically women falls under iron deficiency more than men? Could we say that, or is it always a good mixture of that?
No, I would say 99% of my patients in the clinic are females.
Okay.
Yeah, it's quite uncommon for young middle-aged men to be iron deficient.
Okay.
Mostly women, and in fact, if you take every woman, every female listening to this, 1 in 3 of them would likely to be iron deficient.
We have some comments already coming up, and they have already mentioned that they can relate to this topic. And we also have another question that's come up. Probably, actually, we will take that question for you in a while, but let me just finish up another couple of slides, and then we will jump into your question that you just asked us. So, doctor, it's all yours now.
Sure. So this slide here is talking about pregnancy, and we said 1 to 2 milligrams a day is what you need when you're not pregnant. However, when you first fall pregnant, because you stop having menstruation, your iron requirements actually fall in the first trimester. But then when you come to the second and especially the third trimester, baby and placenta start taking a lot of iron from you. And additionally, you have a red blood cell volume expansion. So you just have more blood as you move through your pregnancy. So it's essentially like you have a cup of tea and you add 2 of sugar, which is iron, and then you add more tea, it becomes less sweet, right? So the same thing is happening to your iron in pregnancy. It's being diluted because there's just more blood. And that's why you find such a high, astonishing number of 75% of women in their third trimester to be iron deficient. So I hope that explains why heavy menses and menstruation are 2 of the biggest risk factors for developing iron deficiency. Now, how do we diagnose iron deficiency? It's done with a simple blood test, which you did a few days ago.
Yep.
And the key thing we're looking for in the blood report is a marker called ferritin. And ferritin actually is actually your iron storage. And the way to remember it, it's like fer in a tin. So like you're storing it in a tin, which is why we have a picture of that over there. Now, the level that we're looking for is a minimum of 30. Anything below 30, we say you have absolute iron deficiency. And ideally, we're trying to aim for levels above 100. So anything between 30 and 100, we say you have low iron stores. And it's below 30, say you have iron deficiency. Now, it's important to know that iron deficiency is a long process if it's not treated. It can happen over many years, but eventually, when there's not enough iron in the body, you're not able to manufacture red blood cells. Remember I said iron deficiency is a key component of your hemoglobin, and when it comes to a late stage, like stage 4, you start to develop anemia, and that's when your hemoglobin starts to fall as well. Now, traditionally, doctors only look for iron deficiency once you develop. So, because we don't routinely test for iron, but we do routinely test for hemoglobin, by the time you pick up iron deficiency, it's often quite late. The patient has suffered for a good 5 to 10 years with low iron and the signs and symptoms that it produces. So essentially, anemia is just a tip of the iceberg, but iron deficiency can be going on for so long, many years, before anemia develops. So you never see what's actually growing below the surface, like an iceberg. So now let's talk about the signs and symptoms of iron deficiency. So once you start to have levels below 30, but certainly below 100, you start to develop a whole host of signs and symptoms. And like I said, because iron is involved in so many processes, the signs and symptoms are so vague and they affect many different systems. So they can start with hair loss. You can start with having brittle nails that break easily. You can experience fatigue, lethargy, tiredness, even though you're sleeping well. And that's probably the biggest complaint or biggest presenting complaint that we have in the clinic. It can lead to frequent headaches. It can lead to poor concentration. And like I said, at the very end, at the very late stage, it could lead to anemia. And that's having too little red blood cells or too little hemoglobin. Now, does iron deficiency just cause these signs and symptoms which are vague and you still can, live your life? No, actually, because I'm just going to take you to 2 medical studies, and I hope they're not too complicated. But I want to show you how important iron deficiency is. So this was a study done in Taiwan. They've got a national register of all the patients, actually the entire population. So they took, I think it was 20 or 30,000 patients, and they looked at iron deficiency, and they followed up these patients, and they found that out of these 30,000 patients who are iron deficient, they had almost a 2 times risk of developing any types of cancer. So if we have iron deficiency and we don't do anything about it, we are actually putting ourselves at increased risk of developing cancer. Now, another study done in UK, I think this one, was looked at 4,000 older adults who are iron deficient, meaning ferritin less than 30, non-anemic, right? So normal hemoglobin. They too found that cancer deaths increased by about 60%, and respiratory deaths increased by, again, 2-fold. These two were not statistically significant, so they show an association, but doesn't show a cause and effect. But certainly for cancer and respiratory deaths, they found very good evidence to show that iron deficiency can increase the risk from this. So now we know what iron deficiency is, how to measure it, how to diagnose it, what the signs and symptoms to look out for. Let's talk about the treatment now. What type of iron do you use to treat it? And this is what you were talking about earlier, Vance. You can use your diet. You can use oral supplements like a tablet. You can use syrups, or you can do an IV infusion. So this is where I wanted to talk to you about. You actually only absorb about 5 to 10% of the iron content in plants. And that's why you eat an entire kilo of spinach and you just get 1 milligram of iron. From meat, the iron in meat is actually called heme iron. So the absorption from meat or heme iron in our gut is slightly better. You absorb about 20 to 30% of it. So like I said, a piece of steak gives you about 3 to 4 milligrams. So all in all, let's say in a day, you get about 3-4 milligrams from your diet. Now that's usually not enough to bring up your levels, but it's probably enough to keep you at good levels once we get there. Now the next best thing is the oral iron, but bear in mind you still have to go through the same GI tract. You're still going to face absorption issues, and you absorb about 5 to 10% of the iron content in the actual tablet. Now the ones that we recommend have 100 milligrams of iron. So if you absorb 10%, you might get about 10 milligrams a day. However, they do cause a lot of gastro side effects like nausea, constipation, sometimes even stomach pain, and sometimes they just don't work. So you try it for 3 to 6 months. That's great. Be sure to go back to your doctor to recheck your levels to make sure they've gone up. Because if they haven't gone up, or you're getting side effects and you can't tolerate the medicine, then we may consider giving you an IV dose. Now, an IV.
Doctor, sorry, just to ask a question for myself, on behalf of the viewers. Unless viewers, please have questions coming up. So we see 3 angles here right now: the diet, the oral iron, and the eye dose, of course, IV iron. But what we can see here in the numbers, it seems that IV works better than food that we eat or even the oral medication, because like you just explained earlier on, that food when we eat, the absorption ratio is there, but we need to eat a larger quantity to have that iron absorption. but even it's going into the oral medication as well. But comparison to the IV, which is, I believe, is intramuscular. Can I say that? Is it intramuscular? That's why the body is absorbing
into the vein.
Okay, it's vein. So it's so much better in terms of these other two segments that we are talking about. If
Correct.
someone who wants to go for IV, is it done like every 3 months or yearly? How's this? I mean, this IV iron has been diagnosed or rather be implemented.
Yeah, so the IV goes into the vein, straight into your bloodstream, and that's when we give 500 milligrams, which is one dose or our typical standard dose. All 500 milligrams gets absorbed in the body, right? It doesn't have to come into your gut or into your stomach and then get absorbed into your bloodstream. So that's why you can get such a high dose. And secondly, how much you need really depends on the underlying cause. So we don't just top up your iron, but we actually spend the time, we go through a history, an examination, try and figure out what the underlying cause is. Because if we don't fix the underlying cause, then just topping up the iron is like having a leaky cup. You pour more water and it's just pouring out the bottom. But generally, like we have the biggest risk factor, which is heavy menses. I would say a woman, if they don't do anything to fix their heavy menses, they might need an IV iron maybe every 18 months to 2 years.
All right, doctor.
Great. So just going to touch a little bit about IV iron. In the process, as you can see, we set a cannula into the vein. We test it with a bit of saline first to make sure we're in the right place. And it's a very simple, quick procedure. We get the iron, which is this black liquid here, and we push it in over about 10 minutes, basically. It's a very quick, almost painless, besides the needle procedure, and it's relatively safe as well. We do keep the patient in the clinic for an extra half an hour. You've been to the clinic, we've got some massage chairs where they can sit and relax during their observation period. Now, it's a very safe procedure. We have maybe about 1 or 2% of patients developing some mild hypersensitivity reactions like flushing, a rash, maybe some chest tightness. But none of these really last very long. They usually last about 5 to 10 minutes and resolve on their own. And then we're able to give the rest of the medicines as well. And then I would say 20% of patients sometimes have an initial slump after the iron, where they have a bit of body ache or flu-like symptoms like headaches. But that again recovers within 2 to 3 days, and you just stay hydrated or take some paracetamol and you should be fine. And after that, you see such an improvement in your energy levels, in your concentration, and whatever symptoms that you might have had at the start. So I'm just going to take you through a case example so it's easier to understand. This was a 33-year-old female who came in with heavy menses, which is menorrhagia, and she had symptoms of fatigue, poor concentration, and hair loss. She tried oral iron, but she couldn't tolerate it. She was getting side effects. And this is her blood work. As you can see, hemoglobin was normal, 12.5. Anything above 12 is normal. But serum ferritin here is 3. And anything below 30 we consider to be absolute deficiency. So she received 500 milligrams of iron, and her levels went up from 3 to 67. After the infusion, her concentration and energy levels greatly improved. But because we're trying to reach 100, we gave her a second IV, and it went up to 173. And within 3 months after that, as you can see the date here, her hair loss also started to improve. Her hemoglobin count also went up to 14.2. So we corrected her iron deficiency, her symptoms went away, and I don't think I've seen this patient back since. And it's been about 2 years now. Now we've got a special blood report from you, and maybe I'll ask you what you think you have or what your diagnosis is with a ferritin of 51.
Definitely, I think it's it's definitely low. Doesn't seem to score like 10 upon 10. Probably I will give this about 1/10. Probably because I think the range we are looking at is between 30 to 400. 51, I think, is pretty much very, very low. So I
Correct.
think
So
13 is low.
yeah, so we want it to be about 100. That's optimal. So 100 and above, we'll be happy. And anything below 30, we say you have absolute deficiency. So between 30 and 100, we say you have low iron stores. So that will be your definition. So treatment here could start with oral tablets or syrups first, but if it doesn't pick up in a few months or you get side effects, then we would consider an IV infusion for you. And I just want to go through, you actually underwent the extended screen. We didn't just do a hemoglobin and a ferritin for you. You underwent what we call the fatigue screen. So these are other common nutrients or problems that you could have underlying that could lead to the symptoms of lethargy or fatigue. So you had a B12, you had a vitamin B9, which is folic acid, both of which are normal. You had a thyroid function test, which is normal as well. But if you see here, your vitamin D is actually very, very low. Do you go out in the sun much?
Yeah. I think probably not being winter.
Yeah.
Probably it's taking shelter with umbrellas and shades on and out.
Or spending too much time in the gym, maybe indoors.
Oh yeah, definitely. So it shows, but you got to agree, right, Doctor? Because now, if you look at the weather, I think the weather is really humid as well. So not necessarily the sun, but I think one who can just perspire just walking out for lunch or so. So which I think every one of us experience that. But this is something very interesting, vitamin D. Apart from the sun, I think we should also be looking at other areas to increase that as well.
Yes, so vitamin D often comes from dairy products, cheese, fish, but also you need adequate sunlight exposure to convert the vitamin D that you're eating into usable form. So we want these levels to be at least 30 to 100, and I try to bring patients to 40 actually. So 10 is pretty low, and I'll talk to you separately about some vitamin D supplementation I would advise you on. Great. So this is just a couple of testimonials from some avid racers. This is a marathon racer. She's done a marathon in all 7 continents. She comes to us for iron, and we gave her 500 milligrams. Fully compliant with WADA, which is the drug agency to, check if athletes are doping. This is not considered doping. This is just replenishing or topping up your nutrients to normal levels. And after her training, she said she had the best training session in a long time. So pretty good testimonial from an endurance athlete who runs quite a bit. And this is also another runner. She gave us this testimonial. She runs almost daily. She was feeling fatigued, weak. She came in, her ferritin was 5. She had a couple of infusions and she stopped feeling fatigued. The dizziness improved, the energy improved a lot, and she now runs quite regularly and has improved her performance as well. And this is data that we've actually collected from our patients, 500 of our patients last year. Out of 500, you can see that about 460 or nearly 90% said that their symptoms were better or much better. Only about 10-12% said that there's no change. And actually just 2 patients felt much worse or felt worse after the infusion. So generally a really good subjective improvement from our patients who have received the IBI. And that's it.
Thank you, Doctor. So there was a very nice presentation done. But as you were presenting, there's a couple of questions that came in just on a constant pace. So, but probably before we take on the questions and answers, I thank Dr. Dheeraj for the great presentation on that. But we also like to say thanks to Vino, who said that thanks for the personal case study that was used for references. I appreciate it. Thank you, Vino, for joining me. Great buddy out there. So, Doctor, we can actually take the first question. I think the first question has already been answered, which, of course, what's required for those who are anemic? And I think you have already answered that. Actually, I'm sure that has already been addressed to you. But if you need more information, you can actually message at this particular number, and then I will able to get you on the required answers. All right. So the number is here. There you go. So you can actually WhatsApp at this number. So the next question that I'm going to ask is about from Sharmila. For someone who don't eat red meat, what other options besides spinach will give the daily quantity of iron? I know, doctor, you have covered that a little. Then perhaps maybe for Sharmila, maybe we can just Shamala, sorry, if I got that wrong. So maybe we can just address that.
Sure, thank you, Shamala. So, some good vegetarian sources of iron are your green leafy vegetables like spinach, but also lentils and chickpeas have good sources of iron. Now, I can give you two quick tips to improve iron absorption. I wouldn't ask anyone to break their religion. I won't ask anyone to eat meat if they don't want to. I don't ask anyone to change their dietary preferences. But what we do is we give you some tips to try and improve the absorption. So vitamin C can improve absorption. So if you're having an iron-rich meal, if you're having lots of green leafy vegetables, have some fruits after, have some orange juice with it, or what you can even do is squeeze some lemon or lime on your salad to improve the absorption. Now, the second thing is that actually coffee and tea, or your Kopi, reduces iron absorption. So, and it's not just the caffeine. So it's actually the phytates and the tannins that's also in your herbal tea. So your green tea or chamomile tea will have phytates in it. Now, this actually just binds to the iron you've just eaten, and up to 80% of it can just pass out through the gut. So if you're having your iron-rich meals, or people who do eat meat and you're having a steak, just avoid having that hot drink 1 to 2 hours before and after that meal, and just let your body give it a chance to absorb the iron.
Thank you. And we also have the viewer, and say that up the coffee. So drink more coffee. But of course, there's also the side effects of coffee, dopamine, dehydration, addiction. Maybe, going for the coffee, probably you want to put extra sugar in there. So it can be two ways. Either you are addicted for sugar or you're addicted for dopamine. So be careful on that. But today, coffee with Vans is just pure water because of the weather. It's really humid, as what doctor talked about. Thanks, doctor, for that. Shamala, okay, thank you so much. So we have also another question that came up, doctor. Thank you, Arish. Thank you, Dr. Dheeraj and Vanan, doing great. Thank you so much. So is hair loss significant or just a gradual on iron deficiency?
So iron deficiency doesn't happen overnight, right? It's through regular menstruation, it's through blood loss, it's through poor absorption. So iron deficiency, unless you have a massive accident or a major bleed, it's a gradual process. So similarly, the hair loss is also a gradual process. Now, there are other nutrients that are also important in hair strength. Iron is probably the most important, but some of the blood tests that we did for you, B12 folate, vitamin D, and actually zinc is very important for hair strength as well.
Thank you, doctor. So we'll take one more before we go into the question that lined up for us in the main message. So just hang on there. So red meat, we talked about it. Okay, so let me just take that message over here. I just got one more over here. There you go. So from Jonathan, how do you know it's lacking in iron? So probably if I've not done the iron deficiency test or the fatigue test, probably I will never know that I was lack of sun. Probably taking too much of shades. That's very interesting to know that. But it also understands for me that by doing a quick, less than 3 minutes, just drawing on the blood and then that's it, right? And then the result comes about after 24 hours or 24 hours. Once come back, then we understand what is that. Then we can go into the diagnosis from a qualified doctor yourself. And so for one who just feels tired consistently, and like what Jonathan asked, he might never know that whether he's iron deficiency or it's just because it's overworking or stress. So how do one put on a line in between the both? Whether is it because of stress or because of not enough sleep or lack of iron? How do we able to understand that, doctor, without doing the test?
It's a tough one because something like fatigue or being tired is probably multifactorial, right? you're possibly working too hard, you're possibly being stressed, maybe not sleeping very well, but it can also be a component of nutritional deficiencies. So now, if you're feeling you're tired, and then maybe you go have a break, you have a week's holiday, not that you're probably having any vacation now, but you had some time off work,
Yeah.
and you come back to work, and the very next day you feel exactly the same. That would probably be the trigger for me to, hey, maybe there's something deeper, maybe I should go look for something else. So that's one thing you can think about. And then the second thing is, if you're having one of the risk factors that we discussed earlier, a female with heavy menses, a man who's elderly, you're having any inflammation in the gut, you get bloating, you might not be absorbing iron really well, then I would say that would be another trigger for you to come and get tested.
Thank you, Jonathan. Thank you, Doctor, for answering that. By Sweta, is there anything I should or shouldn't be eating? But anything food that actually reduces the iron deficiency? I don't think so. Probably, Doctor, you want to advise that?
No, nothing reduces iron. It's just things that can block the absorption, like the caffeine, the phytates and the tannins in coffee and tea. But no, most food that you eat will just improve your iron levels, but it just depends how much.
Thank you, Doctor. So we have another one here. Before we start asking the viewers for any questions, then we can go into a little discussion. Bananas. All right, bananas high in iron. So quite simple.
Not a classical fruit you think of that has a lot of iron. Bananas are high in potassium, but again, the iron that you get from fruits or bananas would be non-heme iron, right? So plant iron. So the absorption won't be fantastic.
Thank you, Doctor. So, what will be the ideal for ladies or even elderly? Is there a age group? I know you talked about the three groups that probably the elderly, the middle, and the young. But in terms of when we talk about for younger kids or teenagers, will that affect? Especially one is going into a young girl is going into a period of what we call is becoming a woman, and in that process, or even for the age where teenagers, the boys are becoming man, so probably that very sensitive age or during that sensitive move, how will be affect the growth? Because we know that lack of iron causes a lot of stuff, but for teenagers, what will that be though?
Correct. So I think you hit the nail on the head that kids that age are going through growth spurts. And the reason that they can become iron deficient is they're actually just using up all their iron that they have for various processes in the body. So iron deficiency can affect teenagers. Again, it's more common in females, especially after they have menarche, which is the start of menstruation. Especially if they have heavy menses or they're growing lots and in quick growth spurts, that actually can use up quite a bit of your iron stores.
Thank you, Doctor. So, of course, as we talk on, there's lots of questions coming in. That's exactly what we want viewers for joining us today in iron deficiency with Dr. Dheeraj at Kopi with Vance. That's exactly what we want. We want more questions to come in so that it's more interactive. But looks like we have a lot of questions that's being posted right now. So, Devishri Balan, thank you so much. So, she has said that I've done the IV twice already, but my hemoglobin or HB level is always back to square one, which is only 8, and ferritin is very low, only 5. My doctor is now suggesting Mirena. Is there a good approach to reduce blood loss for a 32 years unmarried woman?
Okay, thanks, Devastri, for sharing. So, basically, what it seems is that I want to use this analogy of a cup again, right? And the water inside is the iron level. When you have an IV infusion, you're just putting in more water, right? We're topping up the tank. But it sounds to me like you're experiencing heavy menstruation, you're having heavy menses. So that's blood loss. So that's just leaking at the bottom of the cup. So if you don't block the leak or where the water is escaping, the levels are going to keep going down. So yes, you need to probably discuss with your doctor options to treat your heavy menses. A Mirena coil is one such option. It's a hormonal form of contraception. It's inserted in situ in the uterus. It doesn't allow one to become pregnant. If that's part of your family plan, then perhaps it's not a good option. There are other options that you can consider as well. Another one is a contraceptive pill. Unfortunately, that's also a hormonal medication. But there are other options like a pill called tranexamic acid, which is a non-hormonal pill. You just take it on 2 or 3 days of your heavy menses, and it can actually reduce your flow by even 20 to 30, and in some cases 50%. So you might want to discuss this with your gynae or your doctor and see what options there are. I also just want to quickly point out there are more holistic and natural ways to deal with heavy menses. I'm not sure if you're in Singapore, but especially in Singapore, traditional Chinese medicine and acupuncture can also help to reduce your flow. So what I would say, let's try and fix that. And then when you put in the next IV iron, your levels should stay, or certainly they should stay for a lot longer. And I hope that answers your question.
Thank you, doctor. Thank you, Dheeraj, for that question that you posed us. Arish, I know you sent us a question, Arish, but if you just mentioned that if my weight is 100 kilos, but I didn't get your full question, so please type it out and then I'll be able to take that. But in between that, someone has mentioned potassium. How does potassium make a change in the body as well? And of course, added to that, that need to resolve the AV menses issue first. Then, so probably what she's asking is potassium and iron, and will that necessary to solve that AV menses issue first before addressing the iron deficiency?
So potassium doesn't really have a link with iron. Potassium is one of your electrolytes, but it's controlled and regulated by the kidneys. So blood loss, for example, nutritional deficiencies don't really cause potassium abnormalities. But if you're having abnormal potassium levels, then we probably need to look at the kidneys. So it's not really related to nutritional health or iron. The second part of the question was, do you need to treat your heavy menses first before you manage the iron? I think it's something that can be done concurrently. So get your iron levels tested, manage it, treat it with oral supplements or IV. At the same time, treat your heavy menses, because treating heavy menses, again, it's not a quick fix overnight. You're going to take medicines, you're going to regulate your cycles each month, and it's a gradual process.
Thank you, doctor. Thank you for that answering that. Sorry, potassium is for the banana question. Okay, yeah. So, so she was referring to that. Okay, thank you so much. Okay, Arish, we're waiting for your questions while coming up, but then I'm going to take in another few more that just came up online. We have Deepak has asked us, can the lack of iron in the blood affect your bone density?
So iron doesn't really play a role in bone metabolism, but what's important in bone metabolism is calcium and vitamin D. Now, there are some links that if you're vitamin D deficient, you can cause iron deficiency as well. So if you have a problem with your bone density, it might be worth checking your iron, because if your bone density is low, you're probably vitamin D deficient, and that can affect your iron. But not iron deficiency directly impacting your bone density.
Thank you, doctor. Hope that has been answered for Deepam. Of course, as more questions that's coming up, looks like there's a firing questions are all lined up in both of my inboxes, so which is very good. We're going to address this because we still have time. We just finished about 15 minutes of present. I mean, now as the time is looking at it, it's only 15 minutes. So much questions is coming, keep on coming in. So now I'm going to ask doctor a couple of questions that I have lined up. So doctor, we know that lack of iron in the body, which is of course hemoglobin, it plays a very important part where hemoglobin and blood transportation to the entire body system. But of course, and because of that, probably the skin becomes brittle. Your nails become brittle, your skin, your hair starts to fall, and so forth. Doesn't the body produces iron itself?
It's a very good question. And the short answer is no. The body cannot produce iron. So you have to get it from your external sources, basically your diet.
And that comes to my second question, because there's some who don't eat green vegetables or dark green vegetables. They don't want to eat that. And especially, I'm just thinking if that person falls under a vegetarian category, who doesn't take meat but doesn't take vegetables. I mean, there are some who probably, it looks like,
Yeah.
high deficiency can fall into higher if they are very picky in their food. And that is why I'm coming to the next question, which is asking about a lack of results. Okay, so let's get this one done first, Doc. So it's from Philip Jazzy. A lack of which of these will result in abnormally large red blood cells and a condition called megaplastic anemia.
Yeah. So when you have anemia, when you have too little red blood cells, you can have two types of anemia. You can have anemia where your cells are small, which is what iron causes, and then you have anemia where your cells are big, and that's what B12 and folate levels cause. So if you have megaloblastic anemia, or if you've seen that on your report, then it's most likely you have a B12 or a folate deficiency. Because iron deficiency causes your blood cells to be small, B12 and folate big.
Okay, doctor, thank you so much. So, coming back to my question that we were asked on earlier, so the body doesn't produce iron, and when we talked earlier on about this deficiency and how one will be able to know whether they are in low in iron deficiency, or probably they're just tired, or is it just because of their lack of sleep, or stress and anxiety as current status of their lifestyle or even at work. Uh, is iron deficiency or the fatigue test a compulsory? Because it's not compulsory. I mean, we all go for medical checkup, twice a year just to check that. But looks like iron plays a very important part on our functional body function and also on our daily lives, because then we lose concentration and we lose our hair as well, and aging faster. So is there some kind of criteria that one should do their testing every year, every 6 months once, or something like that?
Yeah, so the problem is that the test we did for you, for example, in the fatigue test, your vitamin D, B12, folate, and iron are not routinely tested for. They're not in most health packages. You can go to any of the big hospitals, big clinics, and get the most expensive package, and I can almost dare put my money and say that there will not be an iron test, there will not be a B12 or vitamin D. So this is what we call your nutritional health. Um, Probably something you can just do once a year, or if you think that you might be a risk, then probably something that you do to check. And then once you manage it, we try and maintain it with a normal diet. So it's not compulsory, but probably advisable because it's not something you're going to get elsewhere unless you ask for it. You can ask any doctor for it and they'll be able to do it.
Thank you, doctor. Thank you for that. We also have Iki Carolyn. How much iron is there in IV, and how much is usually given?
I think so. One dose of our IV iron is 500 milligrams, which you can say is almost equivalent of eating about 500 pieces of steak. So it's 100% absorbed and goes straight into your bloodstream. And that's our typical dose. But sometimes, if the patient is very anemic, so ferritin is low, hemoglobin is low, we may consider giving 1,000 milligrams at one shot.
Thank you. Thank you, Dr. Dheeraj. So we have Vinod here. He also asked that, hi, Dr. Dheeraj, can iron deficiency affect the body with either weight loss or weight gain?
Again, I don't think there's a direct link, but if you're iron deficient and you're fatigued and you're lethargic, you're probably not exercising very much. You might be at risk of putting on more weight, and that's probably the link that and how it can affect the body weight. And then conversely, treating iron deficiency should give you more energy, which allows you to do more exercise and help you lose weight.
Thank you, doctor. So, so yes, doctor. So yes, we are discussing, right? So the body doesn't produce iron, and we need to rely on the medical check. I mean, like a medical checkup yearly, to identify that. And once that has been identified, then it will be then looking at the proper diet as well. Sometimes when someone wants to lose weight, usually they go under a very strict diet, especially like no carbs, high protein, and so on and so forth. So during this dieting period, or even this going under this certain kind of diets where they have certain strict regime and programs, like crash diet or keto diet or even the intermittent fasting. While doing that, are we compromising this element of very important iron in our body, which sometimes we fail to, to consume that, generally?
Yeah, it's a difficult one because when you're dieting or when you're eating, you're trying to think about too many things, right? Iron deficiency, getting enough protein, low carbs. Um, it's very difficult, and dietetics is a whole conversation in itself. That's why we actually work closely with a dietitian in the clinic. You can tailor the foods that you should eat for your goals. But what I would say is, again, I don't force people to change their dietary habits to eat meat, or if they're vegetarians, or force them to eat red meat if they don't like the taste of it. But I think you have enough of things to think about when trying to do a certain diet. So what you can do is just have iron at the back of your mind, and then those two tips which I mentioned earlier. Again, vitamin C. When you are having the iron-rich meal, let's just absorb all of it, right? And then not have that protein right after.
Thank you, Doctor. I mean, we still have about 15 more minutes for our Q&A segment to finish. So if you do have any comments, you can actually put it into our WhatsApp group at 818778850, or you can type in the comments and then we can just flash it out to Dr. Dheeraj, and then we can take some of the questions that we still have. Right, we still have about 15 more minutes before we can call it the show off. And so there's another question that's asked us by Mel. What is the relation between iron deficiency and febrile convulsions in children?
I don't think there's a direct relationship. Febrile convulsions are a condition where a patient has a fever, usually under 2 years old. It's quite uncommon to get that after you turn 2, where it causes an electrical storm in the brain that causes a convulsion similar like you would get in a seizure. But that's brought on because of the fever and the raised body temperature. I don't think iron deficiency plays a direct role in a patient developing febrile convulsions, as far as I'm aware.
Okay, thank you, Doctor. We have another question that came in, so we hope that has been answered for you, Mel. Sorry. Iron deficiency or anemia of chronic disease.
Okay, so anemia has many causes, like we touched on: iron deficiency, B12 or folate deficiency. Now, you also have anemia of chronic disease, where a patient has multiple comorbidities or underlying cancer, for example. That can also cause you to have a low hemoglobin level. A low hemoglobin level alone will not tell us what type of anemia it is. So if you have a low hemoglobin, I would still encourage you to go get your iron tested, your B12 and the folate, because you can have anemia of chronic disease and anemia of iron deficiency, and in which point you can still treat iron deficiency and potentially get an improvement in your signs and symptoms, and maybe even a raise in your hemoglobin level.
Thank you, Doctor. Thank you for that. I hope that has been answered to Brad. So, Doctor, for especially women, we are now talking about looks like iron deficiency falls under the more to the woman, of course, in terms of percentages wise, because of loss of blood, and of course, iron is being lost as well, or even for male who's donating blood on a regular basis, just like myself or many others out there. Will there effect on women who trying to conceive when the earlier stages of their life, when because of iron deficiency? Because that could be one of the reasons. Because I do know women who go through a 3 trimesters because of the loss of iron, they'll be given folic acids even during pregnancies and after pregnancies. But how about before pregnant getting conceived? Could
Yeah,
be the iron be a factor for the fertility that we're talking about?
yeah, that's a great question. Actually, a lot of studies have shown links with iron deficiency and reduced fertility. So it is something that I wouldn't say it's a cause and effect. The studies aren't showing extremely strong evidence, but it's certainly showing a lot of length. And this reminds me one of the cases that we've seen in our clinics. She is a Muslim lady, um, been trying to conceive for about 4 years, been through about 3 or 4 different specialties in KK privately. Never did any doctor test her iron levels. She came into us, I think, through a Google search, found out she was iron deficient, had an infusion, and about 4 months later, she was pregnant. And that was really a great success story for us, and it was really nice because she and her husband both came back and thanked us. And yeah, so I think iron deficiency has shown some links with reduced fertility, and if anyone's having difficulty conceiving, it might be worth something that's worth testing for.
Thank you, doctor, because most of the time they do a lot of other testings. But I think this is very important as well because the food that we consume actually plays a very important part. And if one actually falls under regular menses or AV menses, like what we talk about, certain symptoms, and that actually causes a lot of iron deficiency in them. And then if they're trying to achieve something, family planning, or even for the matter of getting convinced, that's not possible, right? Because you can't get it because a lot of stuff that we are looking at. But again, I like to get one more question that's here by Srinath. Will I become anemic if I follow a vegan diet?
No, I think, look, if you want to be vegan, then it's just being mindful and learning the things that will give you enough iron, and especially B12, because B12 commonly comes from meat sources. So things like your tofu, tempeh, and just being mindful and learning about the things that can keep your nutrients up. So any vegan, it's probably worth just testing your nutrients once in a while to make sure that because of your diet you're not becoming deficient in any. No, certainly if you the answer is no if you do it in a well-informed and educated way.
Thank you, doctor. Thank you, Srinath, for the questions. I think we have come to almost the last question itself. Thank you, doctor. I think that will be very in depth because especially we talked about women trying to conceive, but then unfortunately because of a lot of other factors, the stress or the food or even the weight, sometimes. But I think iron deficiency is definitely one part that I think it will create an impact and will create an awareness because even for myself, it's quite strange. I do spend a significant amount in the sun, even though not very suntan, but I'm trying to take a lot of quick run away from the sun, but most of the time in the indoor. So people who are indoor, I think pretty much could be falling under low in that element. Is there something else we can do, or is like every day like a 5 minutes exposure in the sun, but not too much? You get different complexion. Then Kopi said because of lights, and Dr. Dheeraj said that. What would your advice be apart from the sun?
It's a tough one. Actually, vitamin D deficiency is quite prevalent in Singapore, which is quite ironic because we live in sunny Singapore. But a lot of us shy away from the sun. We try and get into the building, into the AC as soon as we can. But you need about 20 to 30 minutes of adequate sun exposure a day to have enough vitamin D.
Thank you, doctor. Thank you so much. So we have spent almost about 1 hour and 4 minutes. It was a great presentation with everything that you talked about. I'm sure our viewers actually appreciate that, and with the number of questions that came in constantly. And as we speak, we also have one last question because I know this gentleman by the name of Harish was trying to craft his message, but I think he have lost it within the two phrases. So I'm going to pull up his last message here. His question, and then from there we will then call it Kopi Beans and the end for today. How much can one eat a day? Iron, food, or snack? Okay, Bhavesh, too much of snack, huh? If example, I'm 100 kilo, I'm not sure about snack. Let doctor get that answer for you, G.
I think, look, at the end of the day, there's a maximum to how much our gut can absorb from the food that you eat. So I wouldn't concentrating on trying to snack on iron-rich foods. I would say trying concentrating on eating a healthy, well-balanced diet, and just being more mindful of the nutrients you're getting from the food. I can't think of any snacks that are rich in iron, except maybe beef jerky, but then that probably causes high cholesterol levels as well. So everything's a balance in life.
Thank you, Doctor. RSG, I think you have to cut the snack, huh? Okay, definitely. That one I will talk to you separately in terms of fitness and health. All right, but I think for deficiency wise or iron wise, I think Doctor has done a fabulous job today going through with every one of us. It was a great pleasure, Doctor, to have you here, Dr. Dheeraj from Iron Suites Medical Center. So, Doctor, if anybody want to get connected with you or who wants to come do their iron deficiency or the fatigue test, where can they look for you?
Yeah, they can just Google us. The clinic is called the ironsuites.com. Or if you just Google iron deficiency, I'm sure we'll come up at the top, and you can just WhatsApp us to book us in for a blood test.
Thank you, Doctor. It was a pleasure of you joining us today. Looks like okay, I'm just going to show this. What's next of I in iron? Google search other sources. So you did a Google search, but okay. So it looks like broccoli, spinach,
Yes.
seedless. So you have done his research right now in Google. RH.
Yeah, so these are, again, you're talking about non-heme iron, right? So plant sources of iron. The absorption is not great. Lentils, chickpeas, yes, they are good sources of iron. Certain nuts are also pretty good. But I wouldn't consider broccoli and spinach a snack. So I would incorporate that into your diet, into your lunch and
Healthy
your dinner.
snack. Healthy snack.
But that's great. I mean, if that's your snacks, great, keep it up. But yeah, like I said, again, at the end of the day, they're not heme iron. So heme iron is only from meat. So the absorption is going to be poor, but it will definitely help.
Thank you, Doctor. Thank you, viewers, for today on all your questions. I know there are more questions that's coming up, and if you do want to get connected and to know your fatigue, please WhatsApp us at 81877-850. And as much as possible, I'll try to get Dr. Dheeraj to, if there's any more questions, we try to answer that, of course, with this busy schedule. Thank you so much for all the viewers who are joining us. Doctor, is there any final wise words that you want to say before we call it a day?
Usually my advice would be to say the females or new moms, if you're feeling to life, to having new kids, or to having a busy job and being stressed, just consider there might be something underlying, and try dig deeper and look into the underlying cause.
Thank you, Doctor. It was really a great pleasure to have you here to talk about iron deficiency, and it was a great test that I've done on my fatigue test to find out where exactly I stand. And I know that vitamin D is really, I'm trying to shine or rather take cover from Mr. Sun, but now I know what to do. But then again, I got to, we got to meet up, we got to catch up and to understand where we are and to see, how I'm going to increase a little bit more on my iron in terms of food. I think it's very important, very crucial as well. Thank you, Doctor. Thank you so much once again for joining us at Kopi with Vance.
Thank you for having me. It's been a pleasure.
Thank you, Doctor. I'll catch you around. Thank you so much. All right, viewers, that's it. We have come to the end of the session today. It was a great pleasure of hosting with Dr. Dheeraj from Iron Suites Medical Center. As I mentioned, I was there 2 days back just to understand a little bit more on iron deficiency and understand about hemoglobin and why this fatigue is coming in, or even why hair loss. But so far, no hair loss, only hair growth in my beard. And that also, it's a good sign. But of course, if you do feel fatigue consistently and trying to find solution for all other areas, like you're going for your massage, going for your R&R and having a good sleep, when you're eating well and drinking lots of fluid and hydrating yourself. But if you do still feel fatigue, that could be a sign of low in hemoglobin. That is because of iron deficiency and because of the flow, right? Our blood is literally going everywhere, every part of our body. And if if a certain element is missing in the blood, and then probably, of course, our body is not nutrition enough, or we are not eating so much enough, or rather we are lacking of that. I discovered that I am lack of vitamin D as well, right? I mean, in Singapore, it's always sunny and summer, and yet, I'm in lack in vitamin D. So it's very important to find out, that we should be including these in our annual checkup, just to make sure that what is happening in our body. We always have this tendency of, sending our car for servicing, sending our equipment for servicing, and so on and so forth. We always pay lots of great attention to the external sources or the items that we have. But I think this piece of machine or piece of body, I think that needs a lot of care and concern constantly, especially with the current pandemic, and it's a lot of stress it's creating. I think we need to be calm, all right, and at the same time we need to take care of our health. So I have learned in this test as well. I think the iron is very important. Even though I watch my diet, especially like spinach and fish and chicken, and sometimes more on vegetables, but that also shows that you could be in iron deficiency. So by doing a fatigue test, less than 3 minutes, and it actually proven that it's an in-depth side of information that you gather about your stats, right? What's happening in your body, which is very, very crucial. So that's why Dr. Dheeraj from Iron Sweets actually invited him to do a talk with us at Kopi events, and that was very, very grateful for him to come over and spending us his 1.5 hours of his precious time, because most of the time he's on call or in the emergency areas where he attends to emergency cases. This was very good in depth to get this information. And thank you so much for all the messages that's coming in, still coming in. But if you do have any questions that related to today's topic, you can WhatsApp at 81. Wait, let me just point it here. 818778850, and I will try to get it replied as much as I could. All right. Thank you for joining again. It's really been a great pleasure. Just a quick information. Our next couple of weeks that we're going to have great topics that's going to come up. We have our microbiologists coming back again, the virus part 2 story. We had covered that the last year, and this year our professor is coming in. So professor is going to give us an interview on the part 2 of the virus. So I'm going to interview the virus itself, all right? And why is he coming back in terms of in the different variant and different kind of virus itself, a combination of things that we're going to understand a little bit. This is all for awareness. And then we also have the gut doctor, Dr. Morgan, also will be joining us to give us his speech. So everything is lined up for the next 1 month. So sit back, enjoy, and get as much of information and get the awareness from, you see, I always point to the wrong side. Kopi with Vance. With that, I am signing off, your host, Vance. Till then, take care, be safe, wear your mask, drink lots of water, and try to avoid crowded places. And we will come out from this stronger ever after. Till then, be strong. I'll catch you again. Cheers. Bye.